I just realized as I start to do this video that I'm just like a talking head because I'm wearing a green shirt and it doesn't show up through the green screen. But this video is actually talking about how this is basically, I think the easiest way to refer to this is life's way or God's way of showing how westernized civilization is not beneficial for humanity. As a virus comes around, and overwhelmingly when we look at westernized countries, right, most of these countries that have no birth rate, right, like the US, the UK, Europe, places like Italy, where overwhelmingly the population is geriatric. Most of the population here is geriatric. And of course, that can be seen by just looking at the median age, right? The median age in the US, 38.1. The median age in Italy, which is why Italy is having such a hard time, 47.3. You look at the median age in the UK, 40.5. All these places are experiencing lockdowns. And of course, then you look at the median age in places like Africa, and the median age is so low. One, of course, that's because there is a lot of deaths of older individuals because of the warring and genocide that's going on, but also it's much more of a patriarchal society, and in places that have adopted westernized sort of mentality of, you know, pushing women out into the workplace and basically killing their birth rate as a result. This is what we get. You get a much bigger geriatric population. So then you have less young people who are basically walking around, which makes most of the older population susceptible, especially to new variants of a virus. Whereas by comparison, when you look at the stats on Africa, which we will be looking at, we'll see why that the virus out there is almost a non-factor. So the new information coming out is that Italy is going back into lockdowns. Italy to impose new lockdowns for most regions as a third wave takes hold. And again, primarily related to age. Overwhelmingly, when you look at the statistics, it always indicates the same thing, that the vast majority of the people who are susceptible to this particular virus are geriatric individuals. And some people, of course, might think that it is either intentional or what have you, because many of these individuals are perhaps viewed from a eugenics standpoint as a drain on society, where most young people can be viewed as more of an asset, whereas most of these individuals are old and just basically utilizing resources. Just basically some of the information that is going around the water cooler, as they say, as some young people refer to it insincerely as the boomer remover. But it is unfortunate to view that way, because if a lot of these individuals, of course, die, they take with them the knowledge and the wisdom that they have already attained, which makes young people much more easily receptive to propaganda. So same thing with the UK. UK still in lockdowns. Their people are not out of lockdown, and they're thinking when they should come out. Both of these countries have killed their economies. More than likely, I should say, both of these economies are experiencing a depression. If you've done any sort of reading in regards to Italy's population, especially job prospects for new people, is all but non-existent, which is why here in America you see, what is it? I think it's like 50% of all millennials are basically have no prospects for the future and are forced to move back home as a result of, one, the money printing, two, the killing of the economy, which all impacts individuals' abilities to be able to go out and, of course, obtain jobs. We see more older people being forced to stay longer into the workplace. People who would have retired have realized that it's not advantageous during these times to retire, because they realize that they might need the money, or they might have individuals within their homes who are a bit younger that cannot find work. And so this puts a lot of young people who would be replacing those individuals not being able to find jobs. And this happens a lot, for example, in the field that I work in, which is nursing, where a lot of these older nurses who perhaps would have retired, some of them did retire as a result of the pandemic, and then some of them unfortunately had to come back or were asked to come back, and some lost their lives. It was an older black nurse who came back, her and her sister. Of course, unfortunately, both of these women were black, and we know statistically black women are 80% likely to be overweight, and this particular disease primarily impacts those who are overweight. And unfortunately, both of those nurses lost their life as a result of coming in contact with these patients, instead of basically putting newer people, basically at the forefront of this disease, when the science showed that overwhelmingly it impacted younger people. Most of those younger people should have been allowed to go back to work to keep their economies going, and then of course putting in restrictions for older ones until of course either a vaccine or therapeutics had made themselves available that were a lot safer than the ones that we have right now. So jumping into the information here coming out of Africa, as I said, Africa median age 19.7. Right, South African, we're talking about this, just the South African population alone, that has a population of 58.5 million. Now, all of Africa, when you do any sort of research, it's very easy to come across the data. Overwhelmingly, this disease is almost non-existent within the continent of I think it's 1.3, 1.4 billion people, and overwhelmingly the disease has not impacted them, like I said before, because the median age is so low that this particular disease is very mild for most individuals, even if they have symptoms. But information coming out of Africa, you can see where I got my last thumbnail talking about this. It says South Africa's decision to halt rollout of Oxford's AstraZeneca vaccine after a study shows disappointing. And of course, it would be disappointing in young people because overwhelmingly young people already have mild symptoms. So again, what is the need to give an experimental drug to your young inhabitants who overwhelmingly show very little symptoms? This is very similar to, for example, the trial and the information that came, for example, out of Israel. I did a video on that. I will link it at the top. That, of course, Israel also has a younger population. They have a much smaller population of only about 9 million. And of the 715,000 individuals who tested positive, only 5,800 of those individuals ended up losing their life, representing only 0.3% of their infected population, not of their whole population, but just of those who tested positive. So again, for the same reason, why would you give something that is viewed as experimental? And of course, now we're seeing more information coming out that for younger people, the vaccine, unfortunately, is realistically not needed. What really is much more needed within many of these countries is to get their economies rolling, to go back to a more patriarchal sort of lifestyle where children are being born, and there are more children being born than there are those who are dying. And so as a result of viruses that you would normally have a less likelihood of individuals experience death, because overwhelmingly most of the people that they would come in contact with would be young and healthy individuals who would be able to clear the virus out of their system. But instead, where you have a population that is primarily older, like for example in Italy or in the UK, when individuals bump into other of their inhabitants, they're more likely to bump into somebody who is more likely to be susceptible to having symptoms, and of course spreading this as a result. It goes on to say, it says the results against its C19 variant may have left the nation in shock, but it also shows how scientists are at the forefront of the battle against the virus. It says 1.5 million doses of the jab have been bought for healthcare workers, and they were due to start getting their vaccinations last week. It says there is no denying that they feel anxious. Why? I'm not quite sure. It may be more of the propaganda that is pushed out than the actual numbers, right? So it goes on to say South Africa has recorded 1.5 million virus cases and more than 46,000 deaths since the beginning of the pandemic, a higher toll than any other country on the continent. And it's probably because South Africa might have a higher median age. Let's just take a look. Let's go South Africa. That answers that question, right? They have a much higher median age than the entire continent, and as a result of that, they have a much higher rate. But when you actually take the entirety of the population, right, there's only 1.5 million, 46,000 deaths. So we'll go 46,000 divided by the 1.5 million cases, and that would bring you to, again, tenths. And this is the the one place. This would represent 1%. This would represent 1/10 of a percent, and this would represent 3/10 of a percent, right? So looking, as you can see, statistically speaking, it's still a very low number in comparison to the amount of individuals who have been infected. And of course, as a result, the primary reason, in my opinion, that the article leads with the disappointment is more than likely over the government's reaction than over the actual virus itself. And we'll read as follows. I had a lot of hopes that the vaccine would change the situation here as a country. It says a lot of people are losing jobs, right? So that's, in my opinion, is really where the worry is because of the government's reaction of shutting places down, people being fearful of not wanting to move around, etc. Just like here in New York, where, you know, in America, there's been thousands, especially here in New York, with thousands of restaurant jobs, retail being hard hit, office spaces, etc. A lot of these places, and of course, the winners were companies like, you know, Walmart, Costco, what's it called, Jeff Bezos with Amazon, right? Many of these individuals were the winners of the pandemic, receiving a lot of the market share that would have gone to some of these smaller mom and pop stores. And as a result of the government shutting them down and then letting these other entities remain open, you see how a loss would take place as a result of the jobs. And of course, in America, 50% of all jobs created in the entire country come from small businesses. So for the government to overwhelmingly shock small businesses by comparison and letting larger businesses go, you can quickly see how we are not living in a free economy, right? The economy is basically handpicked by those in positions of authority. Just like I've shown in my last article that overwhelmingly those individuals who have been impacted, according to the CDC, were relatively overweight or obese. And Americans are, for the most part, 70% overweight. And the very first things that were shut down were, of course, things like gyms, which are primarily responsible for making people and helping people to become healthier via weight loss. And of course, that was one of the first things that was shut down. And more than likely, statistically speaking, the government's choices were more responsible for the lives lost than the actual virus itself. Primarily because, think of, for example, how much weight many of these individuals could have lost over the year. Think about how much weight has been gained as a result. I showed in that last video about the quarantine 15 turning into quarantine 25, and that was for young people. So imagine how much more so for those who are a little bit older, who already are experiencing problems with their weight, being forced to lose their jobs, stay at home more likely, gaining weight, which puts them more at risk, not less at risk. The mask will not save you, but living a healthy lifestyle will, and having a younger population, as according to the statistics have shown. So unfortunately, in my opinion, what this article is really referring to, I'll leave the link for all of these for this article in the description so that you can take a look at it for yourself. Now, realistically, what you're talking about is, of course, the waste, as it says, the wasted time. And of course, it says here, this important country where some 80% of the population cannot afford private healthcare and rely on state hospitals, which are currently overstretched. And so for many of these individuals, it's just going to be unfortunate moving forward. For those who are interested in reading this article, I'll leave it at the bottom of the list. Of course, feel free to like, comment, and subscribe, and I'll check you out next time. Thanks for watching.